Okay, it is 5 o'clock by my computer screen, so we'll get started. I'm Carla from Stonington Free Library. I'm the assistant director there, and I want to thank all of our partner libraries for helping us sponsor and promote the event tonight, which is regarding foster care in Connecticut. We have Tom Moore with us this evening from the Annie C. Courtney Foundation. And I'm going to let Tom take the floor because he's the expert in this very important issue. And we will be taking questions in the chat box and afterwards. And I believe Tom said he's going to share his email address as well. So if you have questions that you think of after the fact, you can always reach out to him. So I'm going to turn it over to you, Tom.
All right. Thank you very much. Good evening, everyone. First of all, thank you, Carla, and your team there for allowing us to present to everybody tonight. This presentation is just basically an overview of foster care in Connecticut. It is a responsibility of the Department of Children and Families, it has now been rebranded as Connecticut Fosters. So I wanted to go through first a couple of myths that are out there, just as we await other people to come in and join us. So the first one I have tonight, and for some reason I'm frozen. I apologize. Oh.
No problem. There we
Okay,
go.
I'm back.
Yeah.
I'm back.
Now they're
Sorry.
all going at once
Okay,
there.
now I'm good. So, first of all, foster care is intended to focus on reuniting the birth family and providing all the services necessary to achieve that goal. And however, when reunification is not possible, Connecticut Fosters looks to place a child into adoptive homes. So what this really boils down to is, as a foster parent, you're working in collaboration with DCF and other supportive services to ensure that the child that's in your care can be, if at all possible, reunited with their birth family. You must be married to be a foster parent. No, you don't have to be married. You can cohabitate, you can be divorced, and actually we have many singles who have agreed to become foster parents. Only younger adults can be foster parents. Well, I'm not young, and I'm a foster parent. So on the contrary, adults of all ages who have a wealth of experience, obviously, to share, can become a foster parent. There's no discrimination on the basis of age, and anyone 21 years of age or older may apply to be a foster parent. Biological parents will not have contact with the foster families. Again, back to the whole concept of trying as hard as we can to reunite the foster child with their biological families. Although there's a minimum visitation set by the courts in the best interests of the child, we really look to the foster families to work with DCF and the birth families to maintain the connections that are so essential for these children that increase the likelihood of reunification. And of course, there's always the one, it's too hard to become a foster parent. It's not really that hard. I think what it is that we have a lot of guidelines and procedures that have to be followed for the safety of our children. And Connecticut Fosters, DCF, will help you through every step of the way. I'll be going through tonight all the steps that are necessary to become a foster parent. In short, it does take, once you decide to start the training, anywhere from 6 to 8 months to become licensed to become a foster parent. So just a little video.
When you think about becoming a foster parent, you have to think about being creative. You have to think about being patient. Anyone can become a foster parent that has the heart to become a foster parent, that is loving and kind and is going to treat the child with respect and dignity.
Become a foster parent and help change the future of a child. Call 475-235-2184 or find us on the web at annec.org.
So just again, a little bit more about the Annie C. Courtney Foundation, which is a nonprofit that we work in collaboration with DCF to recruit families, outreach to the communities. We provide support and pre-licensing and post-op and post-guardianship consultation and kinship support groups. And we're primarily based anywhere you need us to be to spread the word. Two of our main missions for our nonprofit has been developing a program that has just gotten some federal funding called New Beginnings, which is primarily buying a home for our children who have aged out of the foster care system. As you can only imagine, a teen who has aged out, who hasn't had the opportunity to be mentored well on taking care of finances, finds themselves homeless fairly quickly. So our intention is to buy a home where first stop could be coming into this home and learn about some of those things they have yet to learn to enter adulthood and to remain safe. Our second, which just received funding as well, is a used bookstore that we hope to open in the Waterbury area. And the intention of that is to train and employ foster youth in retail and inventory, and obviously allowing them some public interactions so that they can go on and have more meaningful jobs, having been mentored by our staff. So a question always comes, why foster? And I guess there's never really a perfect time to say, I want to foster or I want to adopt. There's plenty of opportunities to say yes. And obviously, many of us always say, not now or no. I remember when my first son, my friend, unfortunately, started having some issues with being able to care for him. And so when I was 26 and he was 8, I started taking care of him. And by the time he was 14, he had become totally integrated into my life, and he moved in and lived with me. And he is now 53. I have 2 granddaughters, and he's my son. And that's the way we have to look at this, is the child that comes into your home for whatever period of time, you're providing the love and the care that's necessary to make them feel safe and secure. So I guess we can really start by saying, all parents or all individuals who come to become foster parents can change a child. You can right now be parenting school-age kids yourself. So you could be an empty nester. You can be retired. You can be experienced, or you can not have any experience, but in being a parent, but you're willing to learn. And DCF and their support services has many organizations that will help that happen. You can be single, you can be married, you can be in a committed relationship, you can be straight, you can be gay, you can be lesbian, transgender. Working, stay-at-home parents. You can rent or own your home or apartment or condo. You can be religious or non-religious. But the fact of the matter is, there's hundreds of children in Connecticut who really need the help of someone like you to be caring and responsible and provide them a safe place as they make their way into adulthood. So what is fostering? Over the last 13 years, DCF has undergone tremendous strides in actually lowering the amount of children who are in foster care. And the way we've done that is that we've really been committed to reunification. So of the children in foster care right now, over 60% of those will be reunited with their families. And remember, that is our goal. The others, if they can't return home, we try to find them a relative or someone within their network of peers, perhaps a teacher or someone who knows them, to become a foster parent. And if that doesn't work, then obviously the child will be placed with an adoptive family. But the main focus here is that we need to give a positive role for these children, and the state has really connections with the children to provide them with caring individuals throughout the state. So the program here is 100% focused on Connecticut fostering and in all of our communities. So in addition to just the basic necessities that you would contribute to the health and happiness of the child, you know, a roof over their head, meals, helping them with homework, you might be the first person who's actually taken time to teach them how to ride a bike or bake a cake or help them with their schoolwork and really have time to focus on them and their needs or listen to them. And usually our foster parents always say that it's the most fulfilling and important thing they've ever done. Obviously, as a foster parent, you're expected to be a role model for the child, develop, help them develop self-esteem, and do everything that you would do for your children. You are a foster parent to a foster child who has become part of your family. And so even though the reunification is a goal, making them feel comfortable where they are and secure is a primary intention. So who are our kids? We have approximately 3,100 children in the foster care system. As you can see, 0 to 6, newborn to 6, and 13 to 17 are the highest population groups. 39% are in the traditional foster care program. 42% are living with relatives or people known to them. So in that situation, we've been able to find a grandparent or an uncle or an aunt, or as I mentioned before, a teacher or a coach who has said, during this period, they can live with us and we'll support them. 6% or so live in congregate care, and 11% or such live in independent living situations. It's that 11% in independent living situations, which also is of concern, obviously, because when they're living independently, the big question gets to become, have they been mentored by anybody along the way to teach them how to handle their finances, know what the next step is, and maybe attending college? So 40% of our kids in that group will end up homeless if they really haven't had a good background and people helping them. And so that is why it's so important to even help our teens that are really in desperate need of support. And obviously, all of our children come from all races, backgrounds, economic backgrounds, and gender identities. So we have foster care, where you help our newborns through 18. We have sibling groups, obviously, where more than one child is, from the family is needed to be supported. We have medically complex, and obviously we have our teen group. Kinship care is obviously the uncles, the aunts, the cousins. Special studies are the teachers and coaches that know of the child and can help. And respite is a shorter commitment of your time, but still helping the children in foster care for a short period of time, while perhaps their foster families are in need of just some time doing something outside of the norm for themselves.
Being a teen is tough. But for teens in foster care, not knowing what comes next their world can feel upside down. And they need you to help turn it around. Provide support, stability, hope, and right their world. Learn how you can foster a teen.
So, on any given day, 4 to 5 children will enter the foster care system here in Connecticut. Many may bounce from one home to another with little sense of permanence and no real place to call home, which, as we all remember from our own childhood, just going home at the end of the day, we knew where we were going and the love that was waiting for us. All of these children struggle with the trauma of sudden chronic separation from the family that's caring for them. I mean, I think we all can relate to just imagining someone knocking at the door and saying, "You have 15 minutes to pack your things. We're taking you out of this home." The child, first of all, has no concept of what's happening. They're obviously going to think, "What did I do?" And they're being removed. So what they need to have is a place to go to at that critical moment, and which will have a profound impact on their immediate well-being and their future, and hopefully allow them to sense some security fairly quickly. You help, as a foster parent, develop that self-esteem that they need, gain trust, learn valuable life skills, and hopefully all those things they take home. I think we've all had that wonderful teacher in school, or someone who we relate to, someone who taught us to do something that's so much a part of our lives. And that's the takeaway. You've given something to these children that they will never forget. Although in some cases, obviously, they may not remember right away, but they will, and it's embedded in them. And you've definitely done something for their betterment. So just a quick review of some of the licensing requirements for becoming a foster parent in the state. As I mentioned, you have to be 21 years of age or older. You have to have verification of a stable income that's adequate to cover your bills. There'll be background checks, obviously, criminal background checks, protective services check, a DMV record check. We'll provide training for CPR. There's a whole bunch of like trainings that, in conjunction with DCF, will be provided to you. You have to have proofs of citizenship or be of legal resident status. And then we'd have a personal interview, home inspections that are done. Bedrooms for the children and adults obviously have to be obvious to our inspectors, and all bedrooms must have doors and windows for egress for fire. A physical exam from a doctor for all the primary caretakers are required. You can be renting an apartment or own your home, as I mentioned before, but the requirement is that there is a spare bedroom in your home for the child that you want to take in. If you're considering them sharing with a child that you already have in the home, the sharing has to be of the same gender and within 3 years of what the age of the child is that's coming into your home. So in this situation, you know, as I put on the slide here, if your son is 8, your son can share with a child coming in from foster care that's a boy between the ages of 5 and 11, 3 years on either side of 8. The maximum number of children in the home is 6. I've been somewhat amazed sometimes when people actually call and they already have 5 kids in the home and they're interested in a 6th and or a 7th. And I'm thinking, wow, that good for them. I can't possibly imagine that many children. But and foster care, as I mentioned, is fine for single people. And we encourage the LGBTQ community to join and becoming foster parents as well. This one flyer that we send out highlights some of the needs of our youth in foster care that identify as LGBTQ. 30% of our youth in foster care identify as LGBTQI. And 8% are more likely to have thoughts of suicide, more likely to reside in a group home, have higher levels of anxiety, and urgently need safe, affirming families to care for them. So, along with our teens and our newborns, this is a group that we really are looking hard for foster families to take them in. Licensing. This is, excuse me, this sort of is an overview of what you have to go through to become licensed. And as I mentioned, it takes 6 to 8 months to get the license. The first thing you do is attend an informational session. That's 2 hours via Zoom. And you can register for that by calling me on the phone. Our executive director, Deb Kelleher, provides that training, and it's the first step in obtaining your license. Once you go through that session, if you wish to continue, a DCF licensed worker is assigned to you within the week. There's then, obviously, a whole bunch of paperwork that starts coming to you via email, which asks to be returned to your social worker that's been assigned to you. We'll do the first home visit, which is sort of like a personal interview and home tour with your DCF worker. And this is primarily just to introduce yourselves and to see that everything that's been said over the phone about the housing situation, the safety of the home, the room that's available, all of that is adequate to proceed with licensing. If all works out, then the next step is the training, and that it's 30 hours of invested time. If you're a couple, both partners have to be part of this training together, and it takes, as I mentioned, 30 hours, but it's either over a 5-week period, twice a week, or a 10-week period, 1 day a week. We're starting during 2024 to open up weekends and also to start trying to do in-person trainings again. Again, up to now, everything's done virtually. And a lot of the services that are offered to you are also done virtually, which makes it sometimes easier for accessibility. The home study is done, which reviews all the home studies, the home visits, the family assessment, and all the required forms. After the 8 months or 6 to 8 months, when your license is approved, that license is good for 2 years. The logos here represent a lot of the partners that DCF has, Connecticut Fosters has within the state. And they're all there to empower and support foster families. And working together, they not only offer training, they offer support. They offer you information on childcare funding, on the health insurance, which is provided to all of our children under Husky, a school lunch program, and in your need of having respite yourselves, providing you those services as well. I think this one sort of hits home for me, although flashlights have changed quite a bit, so I apologize for that metaphor here. But let's just place ourselves back when flashlights had batteries that you threw away and replaced. We wouldn't normally throw away the flashlight that didn't work. And it goes when a person messes up or finds themselves in a dark place. We don't tend to want to cast them aside. We want to help. So You can help the flashlight, obviously, by changing their batteries, and the AA batteries reflect attention and affection. Some of them may need AAA batteries, attention, affection, and acceptance. And some need C and compassion, and some need D, direction. And yet, if they still don't seem to be working and it doesn't seem to shine, more often than not, just simply sitting with them quietly and sharing your light and holding them and reflecting on what is good in them and inspiring them and accepting them will make them shine. I do want to remind everybody that May is National Foster Care Month. And so our drive throughout every community in the state is obviously making people aware of the foster care program and the urgent need that we have for foster care parents. This is the new logo for Connecticut Fosters, which you'll be seeing, I'm sure, in print ads and on television. And this is in part of the DCF family. And in short, how you can help us is obviously first, if you're really interested in becoming a foster parent, I'd appreciate talking with you more, talking a little bit more specifically on any concerns you might have and how we might be able to collaborate and allow a child to become part of your family. Sharing our flyers to raise awareness about our Connecticut children in foster care is always helpful. And that can be at work or on a Facebook page. It's just that constant reminder to people that our children are always there and our children always need a place to call home. And then obviously, if you can't become a foster parent and you have time, if you can support that to a local foster family by cooking a meal, provide transportation to a meeting or a baseball game, or provide gift cards for birthdays, that all helps. We have one foster parent that lives in the western part of the state who sort of aged out herself of being a foster parent. But she was so involved with caring for other children that she knew other foster parents in town. And so once a week, she would cook for these foster families. And it just took a load off of them. And knowing that somebody else was taking care of a meal for that day, because there is so much going on, not only with the children, their own biological children, but then supporting the needs of a foster child. And then obviously there's always the choice that you have to mentor a child in foster care by either reaching out to DCF or obviously a school system where you can offer at least some time, one-on-one time with them to encourage them to be the best they can be. So here is my information. I put my cell number down. That's our office number, my email address for any one that would like to reach out to me. I certainly hope some of you will take away some of this information tonight and ponder it and consider the next steps in your lives and in helping our children in foster care. So I'll end there and open it up for any questions if anybody has any. Thank you.
Thank you so much, Tom. So if anyone has a question, you have the ability now to unmute your microphone and you can ask a question or you can type it in our chat box and we can have a little conversation. So go ahead if you have any thoughts or questions. Okay, thank you. Rebecca
Okay.
asks, yeah,
Mhm.
have you seen any challenges facing same-sex couples?
No, we have not seen any challenges when it comes to that. Obviously, the biological families and the foster families and DCF work collaboratively in assigning the child to a foster family, but we have nothing to report at this point.
And Julie asks, how can we provide information to our community?
Well, that's interesting. Um, I have tried many ways to get in touch with first selectmen and mayors, thinking that the trickle down effect might be the best way to do this here by starting at the top and hoping that they would get in touch with park and recs. It's really, we have banners, we have posters. It just has to be out there. We've approached school systems to say, in their monthly newsletter, could they just report, for example, foster care month's coming up. Have you considered being a foster parent? We haven't found the magic yet to say anything more than it's actually foster parents. It's the word of mouth who are actually our best advocates for finding other foster parents. But in the community, a lot of times just having our flyer out there, we'll get a call, or letting me know if you know of any events coming up where I can have a booth or just put a banner up. That would be wonderful as well. It's just consistency of the message and reminding people that we're there. It sort of reminds me of the old milk carton, when they place pictures of children missing. It's like, it's not that our children are missing. It just has to create the awareness that our children do need homes here in Connecticut.
Thank you. And we have a participant saying, thank you for your time today. We're in the ICPC process with FL, I guess, meaning Florida. Is there anything we can do while waiting for the court order to get the process completed faster? We're in Hartford County.
No, unfortunately, there's nothing really you can do to make it go quicker, unfortunately.
Yes, I guess that's what I learned tonight, is that it all takes time.
It definitely takes time. And obviously, a lot of people come to me particularly at events that I'm at and just say, why does it take so long to get a become a foster parent? Well, we're talking about the safety of our children. We're removing them from an unsafe situation, and it's the responsibility of DCF to ensure that child is being placed in a caring and loving home. And the time, is allows the foster parent also to make sure that they're doing it for all the right reasons and they're being trained properly to handle the traumas that are going to be, the child is going to be coming in with.
And in foster care, in CT fosters, how often do children get placed in the same home? For example, if a child is reunited with their biological family, would they be likely to be placed again with a familiar foster family?
That does happen. Unfortunately, I can't really speak to how many times that happens, because obviously foster families take on other responsibilities once that child is removed and put back with their biological families.
Thank you, everyone, for these questions.
Thank you very
Any
much.
last few questions before we wrap up? It looks like you covered everything.
Okay, well, I hope I didn't scare a lot of people away. Come visit anytime.
I think it was great. It was very informative, and there's a huge need, so
So
hopefully we
thank you
can.
all. Thank you all for your time this evening. Enjoy the rest of the night, and please reach out to me if you have any more questions. I appreciate your time.
Thank you so much, Tom, and thank you everyone who joined us this evening, and please spread the word.